Good morning, I am Dr. Jacob Thomas. I am an MD medicine and a DNB medicine, and I am a diabetologist, physician and a preventive cardiologist. In this session, we are going to discuss about diabetes with hypertension. That is, many of you know that many patients have diabetes and hypertension together. And if these two problems are together, how to tackle it and what are the problems which we are likely to face? 1 in 4 Indian is diabetic and another 1 in 4 is a pre-diabetic, and the incidence of hypertension is also very high. But if you are a diabetic, you have 2 to 5 times more chances of becoming a hypertensive, and both diabetes and hypertension are multi-system diseases. That is, they affect various organs of the body. Just like diabetes affects the heart, brain, kidneys, eyes, the nerves, etc. Hypertension also affects the eyes, heart, kidney, heart, etc. and the brain. And therefore, if these two multi-system problems come together, the end organ damages becomes much worse and much more. The incidence becomes much higher than these problems individually alone. And therefore, it is very important to understand how to tackle diabetes along with hypertension. So what is hypertension? Hypertension is a chronic elevation of blood pressure. If the blood pressure is above systolic of 140 and above diastolic of 90 consistently, then it is called hypertension or high blood pressure. And what is diabetes? Diabetes is a state where there is chronic elevation of blood sugar. So the normal blood sugar fasting should be less than 110 and post lunch should be less than 140. So values above these will be called diabetes. And if the person has diabetes, his chances of becoming hypertensive becomes much more, resulting in lot of other complications. Factors which causes diabetes also causes hypertension. And therefore, these two problems are clubbed together as lifestyle diseases, and therefore problems like overweight, high cholesterol, sedentary lifestyle, smoking, excessive alcohol is more or less similar to both diabetes and hypertension. And therefore, to treat diabetes, whatever lifestyle modification is done also helps in the treatment of hypertension. Diabetes, how does it cause hypertension? So let us try to understand a few ways in which diabetes, if uncontrolled, will result in hypertension. 1, diabetic patients can be overweight. So increase in body weight causes an increase in cholesterol, that is altered lipid profile. That leads to atherosclerosis, that is blocking of the arteries. The blocking of the arteries leads to increased peripheral resistance, that is the stiffness of the arteries, and that leads to an increase in the blood pressure. Diabetics are overweight, and overweight itself causes excess stress on the heart, and therefore the heart has to pump harder, and therefore the blood pressure increases. Diabetic can have a subtle or a very evident kidney damage, and that kidney damage then indirectly increases the blood pressure. Diabetics have a problem where the autonomic nerves, that is the nerves which supplies the heart and the intestines, they get damaged. That is called autonomic neuropathy. Damage to the autonomic neuropathy results in an imbalance between sympathetic and parasympathetic nervous system, and that causes high blood pressure.